Kung nawala na yung mga kasama natin.
Tulog na ata, ma'am, kasi may mga pasok pagbukas.
May pasok sa... Ay, gano'n. Sige, bilisan ko na lang. Tayo na lang, ituloy na natin. Tapos, para, konti na lang pala.
Dalawa, tatlo.
Oo, dalawa na. Ituloy na natin, tapos i-forward ko na lang yung slide sa kanila. Iba rin kasi pag naanohan mo yung
Send na lang yung ma'am.
Oo.
Kasi yun kanina, matagal din ako naka-join. May na-miss ako na topic.
Oo nga, ang hirap pumasok din. Now, andito na tayo sa STD, which is the candidiasis. Ito yung candidiasis, a fungal infection caused by yeast. Ito yung candidiasis. It is usually caused by infected person. Ang most commonly is Candida albicans. Candida normally lives of the skin inside the body, which is placed as the mouth, sa throat natin, sa gut natin, sa vagina, without any cause or any problem. Candida can cause infection if it's grow out of control. Pag dumami siya, that it enters deeply into the body. For example, the bloodstream, internal organs like the kidney, the heart, and the brain. And sometimes the type of Candida are resistant to antifungal, and you can use it as a treatment, yung antifungal treatment na medicine. Ganito yung itsura niya pag nasa tongue natin. Para siyang strawberry skin ba, na pula siya, ganon, sa tongue natin. And we have also trichomoniasis, which is trichomoniasis is a very common sexually transmitted disease. It is an infection with a causative agent is a protozoa parasites called Trichomonas vaginalis. Although the symptoms is disease is vary, most people who have other parasites cannot they tell it is infected. Ito mostly common and curable STD. Sa United States, estimate nila na 3.7 million of people having infected. However, only about 30% develop any signs and symptoms of trichomoniasis. Infection is more common in women than men. Elderly women are more likely younger than women who have this infected of trichomoniasis. Ito po yung itsura niya. Now, we have to go to respiratory disease. Ang mga disease sa respiratory disease, which is the diphtheria, whooping cough, pertussis, pulmonary tuberculosis, pneumonia, SARS, coronavirus. Diphtheria is a serious bacterial infection that is usually affect the mucous membrane of your nose and throat. Diphtheria is extremely rare in the United States and other developing countries. Now we have already the vaccine for this diphtheria. Diphtheria can be treated with medication, but in advanced stage, diphtheria can damage your heart, kidney, nervous system. And even treatment is diphtheria can be deadly, especially for children. Kaya meron po tayong diphtheria na vaccine. Ito po yung diphtheria. Once na kasi, nahihirapan na tayong huminga po. Itsura ng diphtheria. And then we have also whooping cough. Whooping cough or pertussis is highly contagious respiratory tract infection. In many people, it is marked as severe hacking cough followed by a high-pitched intake of breath, sound like a whoop. Before the vaccine is developed, whooping cough was considered as childhood disease. Death associated with whooping cough are rarely, but most commonly occur in infants. That's why it is important for a pregnant woman and other people who will have a contact with infant to be vaccinated against a whooping cough. Meron na po tayong vaccine din ng whooping cough. Ito po yung itsura niya, yung talagang hirap na hirap mag-vaccine, huminga yung bata po. Now we have the tuberculosis. Tuberculosis is a communicable disease that caused by bacteria that are attacked in our lungs and other parts of the body, such as the kidney, the spine, the brain. If not treated properly, tuberculosis is fatal. Approximately 1/3 of the world population, over 2 billion people, is infected with tuberculosis bacteria. More than 9 million become sick with TB annually. Tuberculosis is spread from person to person through air. When a person with active tuberculosis cough or sneeze, tuberculosis bacteria get into the air. So anyone who has a close or frequent contact with this person or active tuberculosis disease can breathe in the bacteria and become infected. So kailangan nakamask po tayo. Generally, it takes several exposure or several hours in order to become infected. So you need to have to mag-wash din, mag-mask tayo at saka mag-gloves din po ito. Ito po yung itsura ng pulmonary tuberculosis. The other part, the right side, ito po yung normal itsura po ng lungs natin. On the other side, ito na po yung infected, yung na-encircle po, infective parts ng katawan natin which is abnormal already from the normal organs. Now we'll go to pneumonia. Pneumonia is a lung infection that can be range from mild to severe that have to go to hospital. It happens when an infection caused in the air sacs of your lungs. Your doctor will call them as alveoli. To fill with fluid or pus that it can take and mark hard for you to breathe and enough oxygen to reach the bloodstream. Anyone who get a lung infection, infants younger than age of 2 and people having 65 of age or 60 years old, pataas na yun, have a high risk. That's because of their immune system might strong not to be hindi na siya mababa na ang immune system natin pag mababa. Kaya nga ang SARS ang coronavirus nagsisimula na sinasabi nila ng pneumonia din. The older you get, mas dangerous siya. But the younger, madali mo pa siyang ma-overcome. Now, ito po yung itsura ng pneumonia. This, yung nasa taas po, that is the itsura po ng normal alveoli. And then, yung nasa baba, may different colors po siya. Ay na po yung itsura ng alveolar niyo po. May ibang color na siya. Yan ang sinasabi niya, pneumonia. Itsura ng pneumonia. And then we have also acute respiratory syndromes, which is a severe acute respiratory syndromes such as SARS, a contagious and sometimes fatal respiratory illness. SARS first appeared in China in November 2020. And 2022 pala. 2002. 2002. Naku, wala na ako. So, within few months, SARS spread worldwide, carried by unsuspecting travelers. SARS shows how quickly infection can spread in highly mobile and interconnected world. On the other hand, collaborate international effort allow health experts to quickly contain and spread the disease. There has been no known transmission of SARS anywhere in the world since 2004. Ito po yung severe acute respiratory syndromes po siya, nung time ng may SARS po. It's just like also yung COVID, pero mas matindi po at ang COVID. Now we will have this coronavirus, COVID-19. Coronavirus, this is an infectious disease caused by newly discovered coronavirus. Most commonly infected with a COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, cancer are more likely to develop serious illness pag pag nagkaroon ka ng pag nagkaroon ka ng COVID disease. And pag matanda ka na rin, delikado rin. So mas maganda yung pag bata ka, mas mataas pa ang immune system mo na pwedeng lumaban ng disease. At this time, there is no specific vaccine or treatment for COVID-19. However, there are many ongoing clinical trials evaluating the potential treatment. The World Health Organization as clinical findings become available. Now, coronavirus, COVID-19 when disease, it's important you should practice respiratory etiquette. For example, when coughing, you have to flex your elbow. The best way to prevent and slow down transmission is be well informed about COVID-19 and how it is spread. You have to protect yourself and others from infected by washing your hands, by using alcohol-based rub frequently and not touching your face. Now, ito po ang niya, itsura ng coronavirus, talagang yung kayo po ay naka-PPE talaga po para maprotektahan din po niyo yung sarili niyo. Now, there are some prevention for na pinapractice natin dito sa UAE and worldwide po. This one, stay home when you are sick. Avoid close contact with people who are sick. You have to wash your hand at the end. You have to cover your cough or sneeze with tissue or have to flex your elbow. Do not eat raw food through thoroughly cooked meat and eggs. Dapat naluto po siya ng gusto. Avoid touching your eyes, nose, and mouth with unwashed hand. Clean and disinfect frequently touches objects and surfaces. Avoid crowd places. Iyon po yung mga prevention na inaano po dito worldwide po. Now we have also the signs and symptoms. The signs and symptoms usually, the first thing is you have a fever, you have a headache, fatigue, diarrhea, a body ache or muscle ache, shortness of breath, you have the phlegm building up, dry cough, hemoptysis. Hemoptysis is a coughing of blood. Yung sa natin, hindi pa rin po i-discuss po yung how to minimize the spread of COVID. Just read it already kasi kulang na tayo ng time. And then ang disease duration po niya, it's either be acute within 3 months time or chronic more than 3 months time. And the implication, vital categories cases in public health. It might be infection transmission, direct contact, indirect contact, airborne, bloodborne, droplet, or sexual contact. Infectivity, ability of organism to enter and replicate in the host. Factor by the epidemiological triangle of host plus pathogen plus environment, it's equal to this disease. So, triangle of host, mismo yung tao, and then pathogen, and then the environment is equal to disease. The absence of one implies no disease can occur, therefore focus on the public health intervention. So you need to have immunization, nutrition, protective barrier, vector control. Now, ito yung infectivity ng environment that causes the human host and environment causing agent. Ito yung tatlo na sinabi kanina doon. Now we have also the vectors. Ito po ay na-discuss na rin po natin sa other part po, sa earlier part. Now, i-discuss na lang po natin yung the disease between the host and infection and symptoms manifestation, threshold of epidemic, of population, and duration of illness before the death or recovery. Ito po yung chain of infection. First, yung germs, the bacteria or virus or parasites will enter to your system. And then, once na enter sa system, ito yung reservoir, the people, the animals, the dog, cat, the wild animals, the food, soil, or water may enter to your system. Now, how the germs can enter to your system or get out, it's by mouth. It is by mouth, by vomiting saliva, cuts to the skin, it comes to the blood, or during diapering and toileting, or from the stool. And then the germs get around. The mode of transmission is either by the contact, by your hands, by the toys, by the sand droplets. When you speak, you sneeze, you cough. And then when the germs get into your portal of entry, it will get to your mouth, the cuts of your skin, and through your eyes. Now, and when it enters already to your system, next is the sick person. When you are the person, you are susceptible, mababa po yung immune system natin. It's either you are a baby or a child or older people with the weak immune system, pag hindi ka na immunized or wala kang vaccination, or any person can get the sickness already. Pag mababa ang ang immune system mo. Yun pa ang chain of infection. Now, the prevention approach, primarily prevention with pre-pathogen. Secondary, prevention measure, diagnosis and treatment. It may be isolation or quarantine. Tertiary, preventive measure, return to normalcy or reapplication. Now, thank you. Tapos na po tayo. Dulog na kayo? Ang haba na, i-forward ko na lang po sa inyo itong slides para mapag-aralan ninyo. Tapos siguro by next time, pwede na kayong makapag-quiz lang, short quiz lang. Open notes naman, gusto ko lahat kayo makapasa. Gusto ko makapag-work na kayo rin kasi may shortage talaga ang mga caregiver or mga nursing aid or mga nurses dito sa hindi lang dito sa UAE but all throughout sa world dahil nga sa illness. So siguro by next week, Friday, pwede tayong mag-exam. Mag-exam tayo, i-covering yung dapat natin i-test yung yung first session natin, which is yung Maslow hierarchy, developmental theories, at saka yung cultural diversities. And then session 2, ito yung communicable disease. Okay lang?
So, bali po next week, 2 exam ang gagawin namin.
2 exam na lang ang gagawin ninyo. Tapos, pag-aralan ninyo yung yung lahat ng slides ang binigay ko. And then, i-forward ko itong bagong slides ninyo para mapag-aralan nyo. And by next week, ang natin, pag-aaralan natin is bed making. So, medyo kasi short tayo ng time kasi actually ang communicable disease, mahabang topic yan. Actually, isang semester namin pinag-aralan nung nurses, nung nag-aaral kami ng nursing. So, kinumpras lang natin na for short term. Actually, kung talagang pag-aaralan natin, even yung treatment, pag-aaralan natin kung bukod sa signs and symptoms, dapat may treatment yung pasyente na gagawin natin, ano yung mga ipo-provide mong services sa pasyente, ganun. Pero kulang na yung time natin. So, ang in-introduce lang natin kung anong klaseng pasyente, informative lang yung naibigay namin sa inyo. So, siguro as you go on with your career, meron pong mas profound explanation at saka studies po kasi ang lahat po ng mga ito about mga 6 weeks lang po natin mga 5 weeks lang, 5 meetings lang ng discussion and then finals na. So kailangan na compress. So kulang talaga yung 3 hours din natin na time. Pero pagdating siguro ng higher level ninyo, ma-discuss din po lahat, including yung treatment, kung ano yung nursing action na gagawin mo, ganun po. Or ano yung services na i-render mo sa patient, being a caregiver. So, yun lang po. Pasensya na at late na tayo. Late na tayo sa thank you Laila May, Lay, sa sa pag-aantay. Send ko na lang po yung ninyo, yung
Sige po. Good night.
pag-aaralan ninyo. Thank you. Good night. Salamat.
Good night po. Bye-bye.
God bless. Bye-bye.